Thank you, Anil. And we'll say, in addition to being a stellar serial entrepreneur, Anil is a wonderful storyteller. One of the magical things about his stories is their viral nature, so I know many of you will be repeating it. When you do repeat it, make sure not to confuse the elephant with the rabbit. So. Dr. Kunkat, could you share with us about?
Thank you. I may not a good storytelling because I am a doctor. I'm a medical doctor by training and by accident. This is about the work that I will tell you. At first, I do not aim to be a doctor because I cannot remember the things. I cannot study good in biology, chemistry. I'm good in calculus and physics. But one day I visit a doctor. I have a stomach ache. He did not touch me, he did not talk to me. I listened and pushed the prescription in front of me and finished. At that time, I made decision that I will not see the doctor anymore in my life. I have two choices. One is I have to be very healthy. Another choice, I have to be a doctor. So after that, I spent every minute of my time to study, read the book, and pass the exam to be the doctor. I love to be a doctor, but my professor looked at me as not a good doctor because I'm not a good grade and I'm not a good medical student. And I also enjoy with IT. So when I graduated, my friend talked to me that you have a wrong choice to be the doctor. You cannot increase productivity. You cannot surgery or treat the patient, two patients at the same time, 4 patients at the same time as a factory. But I want to be the doctor. I want to treat many people as I can. So I have analogy that if I can do something that I can expand my service to everyone in Thailand, have a good health in the future, that would be great. So another accident is come to Thailand. The government turned the way that we go to get the treatment at hospital from fee for service to the capitation. So the hospital have a problem because they do not know how to manage the money, which is very limited. In average, per head is about 100 baht, so it's about $4 4 or 5 Singapore dollar a month for one patient the whole year. So I would like to do some system that help the hospital to manage the patient, to manage the service in the hospital, and take a good care for the patient in the long run. Everyone said you are crazy because you spend hundreds of millions, but the system cannot exist anymore. So I decided to do that with open source system. Everything is open source for the server, for the database, and we have a group of programmers writing the code. And one thing that we face a problem that in the hospital they do not have a IT person. Because my target is small rural hospital, which is about 700 hospitals around Thailand. It's no IT there. No, that's it. If they have a doctor and nurse, it's good enough. So I decided to train everyone who want to join me to be the part of the system. So I create chain maker in every hospital. So I have a driver, porter, gardener, to be a Linux admin, to be the sysadmin. I train the nurse to do data query. After 2 years, I train about 200 any kind of person in the hospital to be a Linux sysadmin or even a DBA or database administrator. Till now, it's 7 years. I still use it as an open source model and give it for free. And we expand from 10 hospitals at the first step, the first 2 years. Right now we have 95 hospitals around Thailand and about 250 clinics all around Thailand that use my system. Currently, I can have a track record of clinical data for the patient at least 7 years. I can monitor. We link the data through the Google Map to see the spreading of a disease, even dengue fever or flu pandemic. So the doctor or the staff in the hospital can do healthcare planning in the area. They can have a data feedback immediately. They can do a diabetic program with making appointment on the same day, do the education, monitor. So we work on this area. Right now, it's not total 6 million population in my system, but I do hope in the future that we gain more and more. So this is all about my work. Thank you.
Okay, thank you. Thank you, Dr. Kumkiat. I think what we're hearing about in each of these examples is how the social entrepreneur looked at what was wrong with the system and is changing it, and therefore fundamentally changing the lives of the people that are affected. So Tim, from you?
So I think that entrepreneurship starts with naivety and unreasonableness. I mean, when we talk about the social value chain, a lot of entrepreneurs look at things that everybody sees, and it just bothers them in a way that other people are like, why does that bother you so much? Just let it go. So I think that for me, the first big itch was, why isn't life fair? In elementary school, realizing that not all nerds are smart was a shock. Clearly, this is not a just system that we live in. And that's just followed me through everything I've done. So in our company, where we, as a nonprofit product design company, design products and services for social enterprise, some of the lessons that we've learned about the social value chain is unfortunately, unlike business school, there is no partial credit in social enterprise. If you look at the value chain, it is not enough to have a great product. It's not enough to have a great idea. In fact, sometimes the innovation part of, we talk to a lot of startup social enterprises, startup businesses, and they're very secretive about their big idea. And it's like, look, secrecy is not your issue. Print the business model on a T-shirt. Obscurity is your biggest problem. And really, the idea is cheap. Ideas are cheap. Implementation is very, very difficult. So alas, no partial credit. The other big insight for us, again, I guess entrepreneurship is often defining what you're not and what things are not, because any decision you make is often more a decision not to do many things than it is to do something. So another thing that I've discovered that relates to the social value chain is that it's not the Olympics. It's not Olympic gymnastics, as Paul Hudnut says. It's there are no points for difficulty. So the hard thing is that you, particularly if you're looking at a trial program, you want it to fail for the right reasons. So if you have an idea or if you have a new program, and to start in the most difficult possible context, and then it bombs, why? Did it bomb because it was a terrible idea? Or did it bomb because you've run out of funding? And I have to say that we've reached a point in our company's growth where in the beginning we had no money, and I would have been taking furious notes at the previous panel. I still did, actually. But there was a point where at least there was some security, because if Design That Matters went under, we didn't have funding. Now that we have some financing and some growth capital, oh dear, now if Design That Matters goes under, it's because I'm stupid or incompetent. So given that all that matters is the impact, you're not going to get credit for, it's not the thought that counts. I think that for us, understanding that a million beneficiaries is a million beneficiaries is a million beneficiaries. It doesn't matter if you took 20 years to get there, 5 years to get there, or a year to get there. Really, the impact is what matters. And so I feel like these lessons have been really important for us in understanding the social value chain.
Okay. So one of the things that I think we'd like to do is to have the audience much more involved, because I think what we want to know are what questions you have, what you're thinking about, and generally in terms of issues on the social value chain and social entrepreneurship in general. So I thought we'd do an exercise where I'd like for everyone in the audience to look at the social entrepreneurs, the different kinds of work they're doing. In the case of Tim, having a design firm that's designing things appropriate for the bottom of the pyramid. Dr. Kong Kiat, starting as a medical doctor, but really transforming things through software and software on an open source basis. And then Anil, of course, being the serial social entrepreneur with the solar lighting and about 500 additional things with that. But when you look across that and some of the other social entrepreneurs you've met during the day, and try to think of, in 3 words or less, what are some characteristics about them? Okay, maybe 1 word that captures. Okay, we have someone here who says crazy. Another person who has another word that you think applies to, yes? Passion. Passion. Okay, interesting. Someone else? Confidence to be different. Right, interesting.
We're hoping for handsome.
Actually, one of the reasons I think they didn't want us to have the costumes, they might have been a little concerned. More from, and someone from this side, come on, join in. There are no wrong answers in this.
Caring.
Caring, right? We've talked about passion.
Enduring.
Enduring, okay. Loud, happy. Fearless. Okay. Restless. Interesting. Persistent. Talent. Okay, so we're hearing a lot of these things, and I think as we're talking, you know, over the last couple of days when we've had about 9 or 10 social entrepreneurs together and discussing, what I thought was really interesting in observing that was how much commonality we had among them, despite the fact really they're representing pretty much all from a different country, from different areas. And so, you know, one of the things that I thought was interesting also when you look at the brochures that we have from Social Icon and look at the catchphrases there, the phrase changing mindsets and creating possibilities. And when we think of the phrases that people had in terms of talent and passion and fearless and how that comes into it. So I thought I'd ask each of the panelists, you know, their reflections in terms of these characteristics.
Let me start. You know, for example, you know, whether it's in the business world or in the social world, fortunately or unfortunately, many of us went to the same school, right? It's just that we took different paths out. But for example, you know, you need a lot of skills, right? A skill set to get this done. So yes, we have to be passionate, we have to be restless, we have to be, you know, all these things are there, but also skills, you know, have to be developed. So just one skill, you know, like when we read on communication, the first thing that people will say is, you know, how to talk, how to write, all these things, you know, as communication skills. Well, as a social entrepreneur, you know, you really have to develop the skills of listening, right? How do you listen? Because it is only through listening that we can be successful. Let me give you a few examples. You know, just recently, you know, and Tim can tell the other side of the story, a group of Harvard students came to Nepal with a $25 incubator. Okay, it's a wax-based system. You boil the jacket or a sleeping bag sort of thing into a boiling water, and it stays the body temperature for 4 hours. It's an amazing invention. So they came, they opened it up in front of me, and it was white in color. Now the first thing I said is, you have a dying child of hypothermia in Asia, and you're going to ask them to wrap it in a white cloth? You see, it's this, you know, automatically we assume that a white is the color of the hospital, not knowing that in Asia only dead bodies are wrapped in white. So it's a lot of listening, you know, that we have to do. At the end of the trip, you know, it wasn't called an incubator anymore. It was going to be called a transport device, because it was going to offer only 4 hours to get the child to a hospital. And so you're basically buying 4 hours to do that. So just imagine, you know, it's a very technical area to work on, but unless you're listening, you know, these issues never come up. Just with the solar light, you know, let me give you an example. Initially, we started with a toggle switch because it was cheap, it was easy to get. What we found out was a lot of, you know, the lights came back because the toggles were broken. And then we found out that because we gave a 5-year warranty, the children played with it. So it came broken. Then, you know, we tried the wall switches. You know, we thought that's better, the wall switches. And then we found out that a lot of them came back because it was not waterproof. And then, you know, one day on the airplane, you're of course changing movie channels all the time, right? And I thought, this switch looks pretty good. So we sourced it, and now we use these airplane seat switches. So even imagine, just with the design of the switches, you've got to learn 3 times. And that's a lot of learning that we have to do. And so I think it's that kind of, sort of deeper listening, that we have to develop as a skill if you're going to succeed. So this one-time switch or a one-time design or a one-time color is not the way, to succeed.
Okay, thank you.